Hi everyone, I'm Dr. Thenarasan. I'm a vitreoretinal consultant at Coimbatore Eye Foundation. So I'll be discussing about diabetic retinopathy. Diabetes mellitus is one of the leading disease in the world. So we'll discuss about how it affects the eye. Diabetic retinopathy can be of different manifestations. So it could be of different bleedings or it could be of swelling of the retina. So how to diagnose and how to screen the patients. Once when the patient is diagnosed with diabetes mellitus, the eye checkup is very important. Usually in the initial phase, the patient will be asymptomatic. So only in the advanced diabetic retinopathy, patient will have a loss of vision. So we shouldn't wait till that time. So that is why once when you're diagnosed with the diabetes mellitus, we need to screen all the patients. So there will be two different states. Initially, there will be a non-proliferative diabetic retinopathy where you need not require any treatment. You just have to control your blood sugar and come for the regular follow-ups. Whereas in the proliferative diabetic retinopathy, you need to undergo a certain treatment. That is why the diagnosis of diabetic retinopathy is very important. So other than that, patient might have diabetic macular edema. So it can also manifest in the initial state as asymptomatic. Later on, patient will have defective vision. So how to diagnose these conditions? We have a different investigations like OCT and fundus fluorescent angiography. So with the help of these investigations, we'll categorize the diabetic retinopathy. In the non-proliferative diabetic retinopathy, we will observe the patient with a good diabetes mellitus control and will ask the patient to come under regular follow-ups. Whereas in the proliferative diabetic retinopathy, again we categorize in the early and the advanced state. In the early state, the patient will undergo laser photocoagulation. It is just a daycare procedure where patient need to undergo 2 or 3 settings of laser in the eye. It takes around 10 to 15 minutes to complete the laser procedure. Once when the patient undergo laser, patient has to come for regular follow-ups. With that, patient can help in preventing the loss of their vision. Whereas in the advanced diabetic retinopathy, whereas it is advanced proliferative diabetic retinopathy, patient will have loss of vision where we need to undergo interventional procedure like surgeries. Diabetic macular edema can be treated with injections. So patient will have to undergo investigation like OCT. We will assess how much is the thickness of the retina. Accordingly, we'll treat the patient. So we have a different variety of injections. So patient needs intravitreal injections. With the help of injections, the diabetic macular edema will be treated. So once it is treated, the good diabetes mellitus control is very, very important. Even though we treat the eye with the different procedures, diabetes mellitus control is the most important factor which will help in preventing the further recurrence and helpful in curing the patient. Thank you.